The Food and Agriculture Organization of the United Nations, FAO, has held a scientific manuscript writing workshop. The workshop aims to enhance the skills of graduates from the front line in service applied veterinary epidemiology training Isavet program. This training is particularly timely given Nigeria's efforts to achieve food security. Details in this report. Launched in 2018, the Isavet program strengthens national capacity to prevent, predict, prepare, respond and recover from health threats at the human-animal environment interface. The program has trained 5 cohorts comprising a total of 156 veterinarians with support from USAID. This workshop is designed to equip participants with scientific writing proficiency, enabling them to communicate their research findings effectively to the scientific community, policymakers and the general public.
And a lot is being done. So by this workshop, they are trained on how to package these reports and publish them for others to know. And it's also a tool for advocacy because people in power may not know exactly what is being done.
It can help improve the veterinary sector, not just the veterinary, but even the health sector, the human health sector. Because most of the diseases that have been coming in are actually from animals. So what we want to do is to prevent the spread of this disease.
We noticed over time that a lot of our graduates don't publish their work after graduating. So we thought this is a good platform for them to be able to write properly and then showcase what they have done, not just within the country, but globally when it's published.
Despite the program's successes, the inability of graduates to translate their research into published articles constrains the program's reach and influence. During the workshop, speakers emphasized the importance of animal welfare and food quality, addressing challenges such as the rising cost of animal feeds to bolster enhanced food production across the entire supply chain.
The change I expect us to bring on board at the end of the day is that by the time we get back to our environment as trained field epidemiologists, what we have been doing is going out to the field for disease investigations. So at the end of the day, our findings should be what we put on record.
This training has exposed me to disease surveillance, which I think is good for every veterinarian, because we go out there to survey diseases and see how we can contain them.
And what other concerned stakeholders can do primarily is to cooperate with veterinarians. So if we notice signs of illness or death in our animals, we should always reach out to a qualified veterinarian.
We really appreciate what government is doing currently in creating the Ministry of Livestock Development. But this is not just enough. We have to bring what we call a 1-8 team, where the human doctors, the animal doctors, and the environmental specialists work together as a team.
This initiative anticipates several key outcomes: enhanced dissemination of research findings, heightened awareness of the Isavet program's contributions, and evidence-based insights to guide policy formulation and resource allocation decisions.
Why? Because I published. Are you getting it?